The Band-Aid was the unit we had before. It was doable, it was safe. We've done a lot of things in it. This is state of the art. This is the next step. My name is Kim Grippy. I'm the nurse manager of the CICU here at Providence Sacred Heart. And I've been in this job now a couple years, but my heart does lie with the floor. So I've been on the floor for over 28 years. When I first started, we were actually 2 units up here. We had an acute and an intermediate all on the same floor. And so we only had 10 acute care beds. And then we remodeled, moved the acute care or the kind of step down area up to the 6th floor. And now we are 22. 22 may seem like a lot of critical care beds, but it is not. And we don't have enough critical care beds around. We don't have enough critical cardiac beds. We do multiple surgeries, as complicated of surgeries as are done anywhere. And we bring people to us from as far away as Milwaukee. And so we're a large facility, and 22 beds was not enough. We don't want to divert the community away from Sacred Heart. We don't want it to go looking to Seattle to receive care. It will be nice to be able to bring the unit up to the standards to reflect what our nursing staff and the doctors do. Number one, the rooms are going to be bigger, and so it's going to be easier to have family in the rooms. Our rooms are so small now, and when you have a lot of equipment in them, there is very little room for families to be there. Most of our patients spend a short amount of time in the CICU, but we have a small handful that spend a lot of time here. And I think there's never been any place for them to go. We don't have a nice waiting room on the floor that they're able to sit with their family in. And a lot of times to get them outside, we will take them all the way down to the main floor, through the lobby, and out to the outside fountain. And that is a real chore. They have equipment and monitors, and nursing staff will go with them. The new unit will have a really unique feature in that it'll have an outside courtyard. And we're hoping that this outside courtyard can become a place where families can gather. Patients, our long-term patients, may be able to go outside and get some fresh air. And not only just be outside, but have a place where they can visit and their families can come. We are so excited. We have staff that have been here for 30 plus years, and they have seen the grandfathering in we did, which is the remodel that we did back in '86. So to see steel on the roof and to see rooms being built, the staff is feeling like, wow, this is really happening. And they are very excited. This gives us room to take care of our patients and to take care of the community in a way that Providence has been for many years.